In many communities across America, primary care providers are in short supply. That's why the National Health Service Corps is so vitally important. NHSC clinicians are making a difference every day, delivering healthcare to people in rural areas, tribal communities, frontier areas, or inner-city neighborhoods. The Corps is a federally funded program that enables healthcare professionals to serve in primary care, while eliminating most or all of their educational debt through loan repayment and scholarships. For more than 40 years, NHSC has built healthier communities at thousands of clinical sites by working to remove the barriers to health that so many people face across the U.S. and its territories.
Oftentimes, their biggest barriers are what we call the social determinants of health: poverty, unemployment, substance abuse, lack of family support, a lack of engagement or connection within the community. All of those things can negatively impact someone's health.
My general population is low-income Hispanic patients, so access to resources to them is sometimes more difficult. Having a provider who speaks Spanish, I notice some of my patients really open up.
Because of the Corps, more patients receive the important primary care services they need, including preventive care, such as checkups and dental exams, and treatment for chronic conditions like heart disease, COPD, and high blood pressure.
Primary care, it's what takes care of the patient as a whole. It's what keeps patients out of the hospital. It's what keeps people healthy.
A lot of the patients that we see, it's oftentimes the first interaction that they've had with medicine, maybe in their lives.
There's some communities we serve that there's no other dentist for these people to go to. All right, y'all brush your teeth. All right, take care.
Corps members work in all types of healthcare settings. More than half work in health centers, where nurses, doctors, physician's assistants, and mental health providers collaborate to provide comprehensive care. The Corps has opportunities for students, residents, and practicing clinicians who are committed to working in underserved communities and passionate about making a difference in people's lives.
I tell staff all the time when they consider coming here, you have to come with that sense of mission and purpose. It has to be sort of in your soul, and then you can express it through your work here.
Your pain's been any better since you started your new medicine?
Yes.
I have had patients who come in and said, nobody's ever cared about me this much, and I can tell that you just really care about me. You know, that has been kind of a calling for me to be able to get out and help people. NHSC kind of opened that door for me. I can't imagine doing anything else. I love it.
While patients and communities improve, NHSC providers also receive financial, professional, and personal benefits from being a part of the program.
This work is a kind of calling for people, and you never want anything like a loan repayment or a heavy loan burden to come in between a person and their calling.
The benefit of being in the National Health Service Corps really expands your clinical skills, and it makes you more confident in your ability to take care of patients. And so when you leave the program, feel more confident in your ability to connect with a wide variety of people.
I've been able to provide care to the people who don't have it. They need me here. And as much as they need me, I actually have felt like it's a two-way street here. I felt like they have enriched my experience not only as a physician, but also as a member of the community.
Part of being in sort of like the helping profession, whether you're a nurse or a social worker or a physician, is that you have to show up at work and be ready to give to other people. Thanks for taking the time to meet with me again this week. Not having that debt has allowed me to have a quality of life outside of work that enables me to come to work and do a good job.
Matching primary care providers with the communities that need them. That's the mission of the National Health Service Corps. Please, consider applying to the Corps today so that you can provide primary care to those who need it the most.